Hey, how you doing? It's number one. It's right here. Okay. Number two's here. He's very hungry. Number three is Jenny Brigg. Number four, her friend, Santana, right? Number five, me. Number six, Lucia Warfield, smile. And there's the speaker.
Every time I was exposed to the sun, my skin would break out in rashes. In hot weather, I experienced an incredible burning sensation inside my veins. I experienced extreme fatigue. Migraines and headaches often occurred. I wasn't able to enjoy the beach anymore. Living in California, summer and spring became my worst nightmare. These are the words spoken of my mother after being diagnosed with the chronic disease lupus. Today, I would like to inform you about the nature of lupus, who all is affected by it, and the treatment options available. Let me begin by explaining the nature of lupus. Lupus is a disease that causes the body's own cells to attack each other. Your immune system is designed to fight off viruses and bacteria, but with lupus, it can't distinguish the good cells from the bad, so it destroys everything. Basically, your body is against itself. For instance, if you have a cold or get the flu, that infection is more threatening than the actual disease. Having lupus, your immune system targets tissues like skin, joints, vital organs. Dr. Sheldon Blau stated in her book, Living with Lupus, that lupus spans from a persistent nuisance to a threat of life. There are a lot of physical side effects, internal and external, of lupus. Internal side effects include swollen muscles, achy joints, fatigue, frequent fevers, things like that. External side effects include loss of hair, loss of appetite, skin rashes, sensitivity to the sun and light, tingling hands and feet. As I've explained, lupus and its side effects are a serious matter, but who all is affected by it? Next, I'd like to discuss how widespread lupus is. Lupus is one of the most common diseases in America. According to a 2009 case study, the Lupus Foundation of America totaled 1.4 million people in the United States being affected. That's a large figure, but that's not including the number of families affected by lupus. Lupus it can decrease your overall health, your mobility, and your active life in general. Depending on the severity of it, lupus may even result in sudden death. With that being said, some individuals are at higher risk than others. 90% of lupus patients are women, ranging from 20 years old to 45 years old. African American women are 3 times more likely than Caucasian women to be affected. People of Chinese and Japanese descents are also at high risk. Keep in mind the difficulties and challenges lupus is responsible for. I'm sure you're wondering how it can be treated and possible options available. Well, there is no known cause or cure for lupus. Medication is one of the most affordable options to treat it. Steroids can be treated. Steroids are used to treat it, and they can be taken by mouth, injection, IV, or placed directly on the skin if necessary. Stem cell transplantation is also a successful option. The process is cells are removed from the blood and reserved. In the meantime, the patient undergoes chemotherapy sessions to remove the infected immune system. After the chemotherapy sessions, the reserved cells from the blood are then implanted in the patient and then restore the immune system to a healthy status. In conclusion, we've explored the nature of lupus, who all it affects in our society, and possible treatment options. Remember the story I told you about my mom, how miserable it was for her to be out in the sun and at the beach, how unpleasant it was for her? Well, she also said, all is not lost, because even though I can't enjoy the beach anymore, I've created my own summer retreat at home where the trees provide shade above the pool. Learning to cope with lupus and live a normal life depends on my attitude and the acceptance of my condition. That's what keeps me from being depressed and able to be prosperous and live an active life. She said, Janaya, above all, you need to know that even though I have lupus, I can still live a normal life.